Mrs. Berger. Mrs. Boyer. Mr. Harris. Here. Mr. Lockman. Here. Mr. Mummert. Here. Mr. Blessed. Here. Mrs. Rinker. Here. Mr. Wright. Here. Mrs. Yates. 9 present, 0 absent.
Okay, I think we can hear everyone with me, correct? Maybe that's a good thing. I don't know. That sounds good. Okay, all right, great. All right, we do have a number of visitors tonight. I'm not going to read through the entire list, and actually I don't think we had everyone signed in. We have 13 people who had asked in advance to address the board. So what we will do with those 13 in alphabetical order, your names will be called after the presentation, but before a vote. Sorry about that. Hopefully everybody heard that. Alphabetical order, names will be called after the presentation, but before a vote. Anyone else in the audience who would like to speak is welcome to do so at the end. We allow 5 minutes per person for public comment. So at this point, I want to hand things over to Dr. Burkhart for a presentation.
Thank you, Mrs. Berger. Can you all hear me?
Coming.
How about now?
Go ahead.
Testing? Okay, thank you. So tonight we're going to start with the survey results, and a lot of this information has been shared with our families. There are some new things that are on these slides that pertain to the current information available for York County. I do want to point out the information we have will be updated tomorrow, so the information on these slides is from September 8th. They only update them once a week. So what I'd like to do, I'd like to start and thank our survey committee members who spent many evenings with us on lengthy Zoom calls to not only discuss the situation that we have in front of us this evening, but to also craft, design, and prepare the questions that were sent out to our families and our staff, and then to come together to look at those results to see so we can put it together in a recommendation and for you this evening. I will say that, as the call that went out last night indicated, these recommendations are in no way unanimous. I think each side had something that they gained and something that they may not have received. But what we did was we tried to bring forth the recommendations that the committee would feel serve the best interests of the students at this time. Again, I know that people will agree and or disagree with the recommendations, but we felt it prudent to share with you all the information that went into it and how we arrived at this recommendation for the board this evening. So many of the committee members asked not to be recognized, but if I could just ask them to stand for a minute so that everyone knows and recognizes the work that they did. So if I would invite our committee members to please stand for just a brief minute and be recognized. And thank you for spending part of your evening with us. So what we're going to start with are the updated information that's provided by the York County, or to York County from the state. And as I mentioned earlier, this will be updated tomorrow, but this is the most recent information we have. Between September 30th and October 8th, you see cases went from 253 in the county to 309, and the incident rate per 100,000 residents went from 56.4 to 68.9. The positivity rate was 3.9 and rose to 4.6. The average daily hospitalizations rose from 67.6 to 82.6. Patients on ventilators, an average of 8.1 to 10.4. And the percent of emergency room visits due to COVID-related illnesses was 1% and rose to 1.1%. And as of today, the district has had 10 positive cases to this point. We do, in the interest of pure transparency, each day we do learn of someone that may be considered a suspected case, and we do our contact tracing, which we talked about a little bit earlier, to make sure that we're protecting the students and the staff in the building, and also protecting the student who may be exhibiting, or staff member who may be exhibiting symptoms, and get them the care that they would need. And finally, the Pennsylvania Department of Education, because we are considered a moderate spread of a county, has recommended the use of the hybrid model or the full remote learning model based on the information that I shared with you earlier. Now I would like to review the survey results from our families. You can see there we have 1,577 responses. And when you consider the number of students in the elementary as of October 1st, we had an 85% response rate. 76% of those students who responded are currently enrolled in a hybrid option. 10% are full-time, either qualifying for an IEP gift in 504 or another exception. And then 14% of those who responded were in the full-time distance option that we currently offer. When we asked the question, if you were able to choose a different model, what would you choose? 53% of those who responded said they would choose full-time instruction 5 days a week. 11% selected 4 days a week with 1 day asynchronous. 16% would like to remain with the current hybrid schedule. 7% would choose the current hybrid schedule with a 1 asynchronous day, as presented at the last board meeting. And 13% would choose full-time distance learning. The next question asked, if the district were to return to full-time in-person instruction 5 days a week, what would our families select? And at the elementary level, 81% had indicated they would come back for full-time instruction, and 19% said they would elect to have their students attend full-time distance learning. If the district were to remain in a hybrid, 67% prefer the current model, which is the EB with an alternating Friday. 5% would select 2 days face-to-face, with Wednesday being asynchronous. 15% would select 2 days with Friday being asynchronous, and 13% would select full-time distance learning. And if the district were to go to full-time distance learning, 60% would prefer a synchronous and asynchronous model, which many of you are aware of, all of you are aware of. Synchronous is live teaching, asynchronous is often recorded or they're working separate from the teacher. The majority of our family would prefer a blend. Looking at those same questions for EHMMS, we had an 81% response rate. 76% are in the hybrid, 10% are face-to-face, full-time, due to the exceptions listed. 13% are enrolled in full-time distance option, and 1% are in our Lincoln Edge cyber school. When asked the same question, if you had to select a model, which would you prefer? 58% of our middle school families chose full-time face-to-face. Now, in this case, the full-time face-to-face would be 4 days in and 1 day asynchronous. And the reason that that is different from the elementary is, in the elementary, the attempt would be to separate the distance learners from the full-time face-to-face learners, so teachers are not teaching both platforms at the same time. In the middle and high school, you will not see that as an option because that is not possible. So that's why the 4 days with the 1 asynchronous to provide time for the teachers in the middle school and the high school to check in and touch base with the distance learners on these asynchronous days, and then also to have our paraprofessionals and others support the students on the asynchronous days. 18% would choose the current hybrid schedule, 10% would choose the current hybrid with 1 asynchronous, and 14% would choose full-time distance learning. If we were to return to full-time distance learning, you can see that the results are actually similar, identical to that of the elementary. 81% would return, 19% would stay full-time distance learning. If we would remain in a hybrid, 64% of our respondents who are families indicated they would like the current hybrid model. 4% would prefer face-to-face with Wednesday being asynchronous. 19% would be 2 days asynchronous on Friday, and 13% would select full-time distance learning. If the district were to go to full-time remote learning, there you can see the same 54% of our families would prefer that. And you can see that the majority, after the blend, would prefer more live than asynchronous. Our family results for the high school, we had a 70% response rate. 75% of the people who responded in hybrid, 8% full-time face-to-face, 17% in full-time distance option. When asked those same questions about which would you prefer on return, 51% chose full-time face-to-face, 17% preferred the current hybrid, 15% would choose the current hybrid with 1 asynchronous day, and 17% would choose full-time distance learning. If the district were to return full-time face-to-face 4 days a week, as mentioned earlier, 75% would return, 25% would attend full-time distance learning. If we were to remain in the hybrid schedule, 53% prefer the current model, 5% would choose the model with asynchronous Wednesdays, 27% would choose asynchronous Fridays, and 15% would still remain distance learning. And if the district learning, or excuse me, if the district were to return to full-time distance learning, again, you see that, again, common practice that they would prefer synchronous and asynchronous way. Moving on to our staff survey, these are broken down by elementary, middle school, high school. In the elementary, we had 139 teachers respond, which is 100% of the elementary teaching staff. When asked which of the following models would they select based on the options available, 19% selected face-to-face 5 days a week, 30% selected full-time face-to-face but 1 day asynchronous, 21% preferred the current model, 29% preferred 2 days of face-to-face with 1 day of asynchronous instruction, and 1% would select full-time distance learning. If the students were to return full-time face-to-face, which model would the elementary staff prefer? 48% preferred 5 days a week, and preferred the 4 days a week. If we were to return for hybrid, 21% of the elementary staff 4 days a week with Wednesday as asynchronous, 28% 4 days a week with Friday as asynchronous, 11% selected 2 days a week with Wednesday as asynchronous, 24% with Friday as 2 days a week with Friday as asynchronous, and 16% selected the current hybrid model. If the district offers staff the opportunity to teach remotely, 19% had indicated they would be interested in doing that, and 81% had indicated they would not. If the students were to return on the same days known social distancing would not be maintained in the school environment, a statement that best describes how they feel. 26% had indicated a constant worry about personal and student well-being. 38% had indicated they were hesitant but willing to do so if required. 29% indicated they were generally comfortable but would appreciate precautions. And 7% would be completely comfortable. Based on how you feel, these are the actions that were offered. 1% had indicated they would pursue a leave of absence. 0% would resign or retire. 52% would seek additional support from administration to continue to do the good work they are doing. And 47% would need no additional support to continue to do the good work that they are doing. The middle school staff survey, we had 55 respondents, which represented a 72% response rate. You see the questions are the same. This one, the staff survey had the full day, 5 day face-to-face for all. Even though our middle school folks selected it, it was a low number, but that would not be available. You see their response, 5% would select it if it's available. 4% would prefer the 4 days with 1 day a week of asynchronous. 18% would select the current hybrid model, 64% would select 2 days of face-to-face instruction with 1 day of asynchronous, and 9% would select full-time distance learning. If the staff were to remain on a hybrid schedule, 4% had selected 4 days a week as asynchronous, with Wednesday as asynchronous. 11% selected 4 days a week with Friday as asynchronous. 27% selected 2 days a week with Wednesday as asynchronous. 47% selected 2 days a week with Friday as asynchronous. And then 11% had selected the current hybrid model. If all students were to return on the same day, knowing social distancing would not be maintained, 62% would have a constant worry about personal and student well-being. 27% would be hesitant but willing to do so if required. 7% would be generally comfortable but appreciate precautions. And 4% would be completely comfortable. Based on how you feel, what action would you take? In middle school staff, 13% would pursue a leave of absence, or the options, 4% would resign or retire. 54% would seek additional support from administration to continue to do the good work they are doing. And 29% would need no additional support, just continue to do the good work they are doing. Staff survey from the high school is next. 79 respondents, which represents 85% of the staff of the high school. Again, similar questions. Current options available, 11% would prefer the 5 days a week. 20% would prefer face-to-face instruction 4 days a week with 1 day of asynchronous. 9% would select the current hybrid model. 50% would select 2 days of face-to-face instruction with 1 day of asynchronous. 10% would select full-time distance learning. If the staff were to remain on a hybrid schedule, 14% would prefer 4 days with Wednesday asynchronous. 16% would prefer 4 days with Friday asynchronous. 22% selected 2 days a week with Wednesday as asynchronous. 39% selected Friday, 2 days a week to Friday as asynchronous, 9% selected for hybrid model. Continuing with the staff survey, if they were all to return, we need the students knowing social distancing would not be maintained. Statements that best describe their feelings, 54% would have a constant worry about personal and student well-being. 21% would be hesitant but willing to do so if required. 17% would be generally comfortable but appreciate precautions. 8% would be completely comfortable. Again, based on that information, how would they, what action would they take? 13% pursue a leave of absence. 3% would resign or retire. 48% would seek additional support from administration to continue to do the good work they are doing. And 36% would need no additional support just to continue to do what they are doing. Now, what we asked the board, what we asked is our elementary principal, Dr. Kelly, Dr. Smil, our middle school principal, and Mr. Downs, our high school principal, are going to present some of the academic information and other information related to the hybrid schedule to provide an update for the board at this time. So, Dr. Kelly, I'll turn it over to you.
Thank you, Dr. Burkhart. Over the past several months, some of the many structures that we put in place to support our students and teachers through the hybrid schedule and distance learning include the following. This is just a small snapshot of some of those that I'd like to highlight. The support staff and paraeducator schedule has been created this year to support classrooms that house both in-school learners and distance learners at the same time. When possible, we worked toward having only distance learners in one session at a time. Student concern processes included counselors, instructional support teachers, principals, in addition to Brittany Leiden, who was used to support students as well as families. Elementary grade level team meetings are happening weekly to ensure that collaboration is occurring across the district to support one another. And weekly PLC team meetings with principals and teachers teams to help support and meet the needs of both students and teachers are occurring as well. I'd like to provide examples of some of the concerns about the hybrid schedule distance learning that have been shared with the elementary principals from parents and or teachers. And again, this is just a highlight of some of those. There's an inconsistency of hybrid students for in-school sessions based on the AB schedule. And that just happens because of days off, and we're doing that by Monday, Tuesday, Wednesday, Thursday, and every other Friday. Technology difficulties for families at home and students at school as well as at home have caused us some issues over the last several months. Inconsistent work completion by our students, especially those during their home days or our distance learners. It's very hard to really garner the attention of our youngest students through the distance learning. It becomes a challenge, especially when parents are busy doing something in their home and the children are trying to participate in synchronous learning, and keeping their attention is a challenge. Guided reading has been challenging to ensure that social distancing is able to occur in the classroom while attempting to have small group guided reading sessions taking place. Our teachers have been extremely creative in that, but it has been stressful trying to continue with our guided reading. Specialists are traveling, our art, music, and library are traveling to teach in the classrooms via a cart. That has been a challenge as well for them, and they're doing the best that they can with that. And we're sometimes challenged with ensuring that all the curriculum is taught and learned to the best of the ability for the students. Some of the benefits, however, that we've seen for the students and teachers by starting the year using the hybrid schedule and distance learners, our class sizes are smaller, which has really allowed for support to be provided during class. That has been something that a lot of teachers have said has been really quality instruction, being able to take place in that small group setting. Deeper connections with students is another strength or a benefit. The pacing could possibly move quicker when we have smaller groups of students, so we feel that that is a benefit as well. We've been able to include and use the 6 feet distance, which is the CDC guideline, and we're doing that quite well at the elementary level. Student progress is more easily monitored, so reteaching can be done more immediately because of the smaller number of students. And teachers have done an exceptional job of implementing the new structures developed by the principals to ensure that hybrid and distance learning was as successful as possible. Thank you.
Thank you, Dr. Kelly. I'll ask now Dr. Smil. middle school.
Dr. Burkhardt asked us to put together just a couple things regarding the academic and the hybrid model in our building. He gave us 4 guiding questions, and I'm going to kind of go through those questions and just share some of my thoughts and conjectures. The first question he asked us to talk about was just to provide some academic data collected that suggests and compares to previous school years. And I'll just share a couple things in regards to distance learning. Last week, we have about 170-ish kids in our distance learning program. There's a give or take, it changes consistently. And last week, we sent home about 55 letters to students, to the parents of students who are struggling to complete work. And at this time, it's really putting a lot of danger in their first marking period grades. And that's been something that we've been spending a lot of time doing. And that's our full-time distance learning kids. I will share, and I don't have specific academic data on this, but in regards to our hybrid kids, there are several of our kids who are struggling on their at-home day. If I had to quantify a number, I'd say every teacher has about 10. Of our core teachers have about 10 kids who are really struggling on that at-home day. And I will just share, from my perspective, it's really hit our 6th grade kids. And if you think about our 6th grade kids, last year at the end of 5th grade, their year was shut down. They moved to a new building, which is completely different. They're still elementary, very elementary in nature. So it's been a really difficult transition for many of our 6th graders. And I would say probably about 10 to 12 kids on each of our students, each of our teachers' caseloads, are a struggle on those days, which impacts the continuity of the education when they return on the face-to-face days, because those are days where they're previewing information, they're applying the information that they learn in school, so that has been a challenge and a heavy lift for our teachers. As far as structures that we have in place, we have our cold intervention model that we're utilizing. In past years, we've utilized that for very specific interventions and enrichments for our kids. This year, we're utilizing it more as a flex period, and that provides our teachers an opportunity to meet with kids and work with kids who need extra time to complete work or just need some additional face-to-face time with the teacher. So that has been something that has worked well for us. I will be honest, in the midst of a renovation, it's been challenging because our intervention program is an all-hands-on-deck approach. And we have teachers that are sharing classrooms, and we really focus on having small groups, and having limited space has impacted that quite a bit, and that's a challenge for us, particularly with our intervention period. As far as concerns with the hybrid schedule, many of the things are things that I've already talked about. The continuity of the education for our kids on their at-home day, comparatively speaking to the days they're in school. That's a challenge for our kids in the distance learning because of the evolving numbers, the back and forth. Again, we started the year, I know we've documented this before. At the start of the year, we had about 85 kids in a program. When I looked today, we were at 161, so that number has changed dramatically. There has been some benefits to the program. When you think about from a purely academic perspective, it's not ideal. I think we all realize and understand it's not ideal. But from a safety perspective, coming into the school year, it has worked for us. If you think about the cases we've had, work in the community just like everybody else, we're going to have cases. But what we feel good about is that we've been able to isolate all those cases, and we have not had one incident of community spread. So from that perspective, from a pure safety perspective, it has been good for us. In addition to that, the class sizes are smaller. Although there is less time with the kids, the teachers are able to develop connections with those kids and work with those kids, and in some respects move a little more quickly through material while they have the kids. But again, it's not an ideal situation, but in regards to safety, we feel that it has worked for us in that regard. So are there any questions from anybody on the board? All right, thank you.
Thank you, Dr. Smell. Mr. Downs.
Good evening, everyone. As Dr. Smale said, Dr. Burkhardt asked the high school here to prepare answers to the 4 questions also. So the first question was academic data you collected at this point in the year and what it suggests when compared to previous years at the start of school. So what we did is we pulled our weekly failure list, which we do every week in high school. And we pulled our weekly failure list from the first week of October 2019 and the first week of October this past week. And what we noticed is last year in 2019, 90 total students were failing at least one course in the high school. And there was 119 total courses failing. So some were failing 2 courses and so on. This past week, 298 total students were failing at least one course. And that's 535 total courses failed. So basically, what's that equate to? That equates to the first thing about the number of students failing compared to last year in 1 week. It's a 330% increase of students from 2019 to 2020 failing at least one course, the same exact week. And then number of courses failed is an increase of 450% from last year. What is the breakdown of those students that are failing, the 298? 60% of those were AB hybrid students. So they were the students coming AB and then every other Friday. 7% of those students of the 298 failing last week were full-time face-to-face. And 33% of those students failing at least one course were distance learners. So there's some data to look at comparing the 2 years from last year when we were normal school, just like usual. Second question was, what structures have you put into place in the hybrid schedule distance learning to better support students and the teachers? The district provided Zoom accounts for every high school teacher. We have Period 5 Encore, which allows our teachers to have enrichment, remediation, and so on. Synchronized learning for distance students. A lot of our teachers are doing both. So they have face-to-face, and they got a laptop there and a camera, and they're doing the synchronous, and kids at home are learning at the exact same time, which is a huge effort by them. Limited morning meetings for our teachers, so they have time to work with students, connect with students, plan, and so on. We really have cut back on our morning meetings to give them that time in the morning. And communicating with families to the best model of learning for their individual student. And finally, our departments have been doing a great job working within their department and sharing best practices with each other. Like our math department really collaborates well together, our science department, and so on, through all the departments. Third question was concerns about the hybrid schedule distance learning that have been shared with you from parents and teachers. We heard from parents and students that there's a lack of consistency, unable to get into a routine with their learning, technology issues, internet connectivity issues at home and in school, Zoom meeting issues, audio and visual issues, inequity for regular ed students versus students with IEPs, GIEPs, 504s, and so on, who can attend full-time face-to-face. For the teachers, we heard some concerns from them that there's technology issues, student compliance, completion of their work, especially at home when they're not here, testing integrity, lack of time to connect with distance learners, increased planning time outside the workday, and planning 3 to 4, sometimes different cohorts of students per class. And the last question was, what benefits have you seen for the students and the teachers by starting the year using the hybrid scheduled distance learning schedule? Social interaction, you can tell the students are happy when they're here. It's good to see them back in the building. There's that energy back when we have kids in the building. Obviously, we have extracurriculars occurring. A lot of students are very happy about that in the fall here. We could follow recommended CDC guidelines and PA Department of Health guidelines with social distancing and so on. And we think also there's a benefit that last spring, obviously everybody was in distance learning, so this gradual rollback to the hybrid schedule kind of let everybody come back in or get their feet wet a little bit. How's it feel to be back in school? Do we feel safe or not? So we think that was a good gradual return to school to start the school year. Do you have any questions of me? Thank you. Oh, okay. Thank you for your time.
Thank you, Mr. Downs. And then continuing with, on the safety precaution side, what we have in front, I know that's small, and I apologize for that, so I will take the opportunity to read them to you. Some of the things that we are doing, cleaning high-touch areas on a regular basis, sanitizing buses after each run, a masking order that's been in place since the start of the year, limiting outside visitors, reducing the sharing of materials between students, social distancing to the maximum extent possible, HVA systems running to increase air circulation, and that's being accomplished through CO2 monitors. Mr. Osborne has shared with us in previous discussions that an average room is about 1,100 to 1,200 parts per million of carbon dioxide in a room. Through the increased ventilation, we're averaging about 800. The lower the CO2, the higher the turnover, the more fresh air that's introduced. Students report that reports of their classroom upon arrival. There's no opportunity to see that down to congregate. They go right to their classroom. And we have staggered student dismissal to the best of our ability at all the buildings. And we're fortunate to have one of our administrators, Dr. Coons, who is Johns Hopkins trained contact tracer. And she has been invaluable in the process and has been our main contact with the Department of Health to intervene with any student or staff member who may have been exposed or is currently considered a positive case. Additional precautions I'm sure will be shared when we talk about them, or if there's questions that come up. But those were the ones that came forward as we have a conversation. All of that information brings us to the next slide where it talks about recommendations. I'm hopeful many of you saw these last night. Again, as I mentioned earlier, these are no way unanimous by the committee, but were discussed at length. Recommendations for elementary return to full-time instruction 5 days a week. The middle school would return to full-time instruction face-to-face 4 days a week, with Wednesday being an asynchronous day. The idea behind Wednesday being asynchronous is it never puts the kids out more than 2 days. Southwestern High School would also be the same as EHMMS, 4 days a week, with Wednesday being asynchronous. Full-time distance learning would continue as an option for students in K-12 who wish to remain in that model or would like to change to that model based on the recommendations tonight at K-12 group. Beginning in November, we are recommending one Friday a month where students will be dismissed early so that teachers can use the day for planning and related professional tasks. If approved, those dates will be communicated to our families within the next week so you can plan accordingly. Recommendations for updated phasing continuing. If approved, families will receive an email no later than Friday evening asking for a commitment to one of the two options provided. We are recommending an implementation date at this time of Monday, November 2nd. If approved, that would permit time to, some of the classrooms have to have desks put back into them, some bus runs may need to be adjusted, and we would have to also begin ordering more supplies for the cafeteria since it's operating at half capacity. If a student's schedule or teaching assignment changes, they will receive a revised schedule from their building principal. Obviously, that is contingent upon receiving timely responses from our families, so we know if there is a change, what options have been selected. We would also assign paraprofessionals to support teachers and students on asynchronous days in the middle school and the high school. One thing we ask is that due to staffing concerns, and if I can explain that a little further, if we have students that select distance learning for the remainder, or at this time, and we balance class sizes, and you heard a couple of principals say that some people were switching back and forth. We want our families to really take some time to consider this, because once you make this change, we're going to ask you to remain in for the remainder of the year because the balance of the class sizes is not something we have a lot of liberty to adjust. If we set class sizes to the lowest number possible, and we have 5 people need distance learning, and they're all in the same building, that would take the class size that might be less manageable than it would be, and would create an imbalance. So we're going to give as much time as we can for our families to consider that, but we want to make sure that we communicate what our preference would be for that reason. We also, in addition to that, if there is an unforeseen change of circumstances, and those are between the building principal and the family, they reserve the right to make that change. So, obviously they would consider it and they would work with you to do everything they could to support that change request. Other considerations for our families. Under the current recommendations, the district will not be able to maintain the recommended 6 feet of social distancing in the environment or on the bus. There will be a potential increase of community spread, which may result in classrooms, after-school activities, buildings, or district closings with little notice. I would like to reiterate that. I know there are times when the messages come out and they are inconvenient, but I can assure our board and our families, we tell you as soon as we can. And as we all know with this current virus, it can pop up in a day's notice. And so we tell you as soon as we can, but we ask all families, regardless if it remains hybrid or we change, please have a backup. there will be potential for the student's teacher to be changed, more in the elementary than anywhere, as a result of the recommendation being made. That being said, to our board, the administration will do all they can to maintain that teacher for that student. But because of the distance learning and some people being assigned exclusively to distance learning in the elementary, there is a chance that the change of teacher could result. And that the building may need to close and utilize an asynchronous day or a delayed start due to staffing shortages that can include our teaching staff, our transportation staff, and our cafeteria staff. Again, we'll do all we can to maintain a normal schedule. I spoke with Dr. Hartman today at length. He has some very good ideas to try to increase our substitute staff, but that is a concern. So that would conclude our presentation to the board. Mrs. Berger, I'll turn it back to you, and we have our administrative team here to answer any questions that may come up as well.
Thank you. Thanks to each of the administrators that participated, and thanks as well to the committee. I know you committed quite a bit of time, and we appreciate your efforts. I would like to give the opportunity for board members to ask any questions to the administration before we allow public comment. Are there any questions? Yes.
School and the high school level. With the results, 17% of teachers at the middle school and 16% at the high school have indicated that they would seek either a leave of absence, retire, or resign. Do we have a plan in place? Because that's a pretty significant portion of staff if we were to move to this full-time fixed schedule.
I'm going to ask Dr. Hartman to respond to that. He's taking.
Sorry about that. Scared the baby. Sorry about that.
I apologize for that. I'm going to start back here. Maybe if I get further away, it's going to be better. So I'll ask Dr. Hartman to address that because we have talked about some of the strategies and some of the things that we need to do with regard to that question. So, Dr. Hartman.
Sure. Thanks, Dr. Burkhardt. Thanks for your question, Amanda. As far as a concrete plan, we've identified, we are aware of who indicated that on the survey. It's, to be quite frank, it's difficult to fill positions this time of year in a normal year. But our plan would be to go through our same recruitment strategies we normally would. We would be able to fill those positions with subs until we found a permanent or a long-term solution. But out of the percentage that made that request, the first step would really be to reach out to those individuals to see who really is considering a leave. I don't know if everybody who indicated that on the survey would be or wouldn't be. There are limitations to what would make somebody eligible for a leave. So we would have to reach out and have conversations as the first step. But then from there would be going through our normal procedures for how we would fill any type of medical leave or vacancy that might pop up from time to time throughout the school year.
What is our, and I'm sure you have one, but what's your plan for evaluating and observing day to day as we go along?
Are you asking observing the instruction in the classrooms or the academic progress? You could speak it a little more carefully.
Whatever plan we leave tonight with, as far as the kids being in school, what's your plan for reevaluating that? Like weekly, daily, monthly?
We would respond. It's a great question. I don't know that we would recommend a transition back to the hybrid. So the evaluation of what we're in terms of full-time, if that was approved, I would anticipate us evaluating that on a daily basis because, as Eric stated earlier, if we do have an outbreak of cases, in consultation with the DOH, they would recommend closure. That could happen by a classroom, a building, or an entire district. So we I would say that is happening now as well, so I would say it's
You will be in contact with the Department of Health and all of that.
Dr. Coons.
The important people in the state making the decisions.
Yes, Dr. Coons, I think she has one of the county nurses. And I don't say that to be flip. I mean, I really believe she has established a wonderful relationship with her, and she's now turned into they both are great resources.
Good. Thank you.
I'm sorry, I have one more. I just would like to express gratitude for the staff and community members who time and energy to put forth this survey and the results. So thank you. With that being said, I know with the initial reopening plan back in July, Dr. Freer was engaged. My understanding is that she was unavailable at this point. But was there any input from other medical professionals in this survey, part of this committee?
There was not. There was no. We followed what we put up on front of the committee, or excuse me, the board at the start, the DOH guidelines, which indicate that the district's recommendations to maintain hybrid or full-time distance learning.
In my understanding from the state, those standards or those recommendations have not changed since July.
They have not. That's correct.
Any others? And I do want to give an opportunity after public comment for board members who may have any questions before a motion is made. Okay, if there are no more right now, I'm going to go ahead to the list of those who had asked in advance to speak. Again, I have 13 individuals. Number 1 on the list is John Bonds. Okay. Yes. Yes, thank you. And I should have mentioned, thank you for that. We received many letters today through our public comment email, and all of those letters up until about 5:30, maybe closer to 6, were forwarded on to the board. And we know that we have maybe just a handful that are left that we haven't seen. But I do want everyone to know that those were received. We do not have any intention to read all of those letters out loud at the meeting tonight. But every board member does have those. Thank you. Okay, next on the list, Jen Bowman.
Hey, thank you. First, just wanted to express some gratitude before I even read what I have prepared. This is not happening in other districts. We are not forming committees and asking for input from families and staff members. Not all boards are even allowing people to get up and express concerns. So it is with appreciation that we extend our gratitude to all of you for allowing this to even occur. My name is Jen Bowman. I am a 6th grade math teacher at the middle school. I also serve as a team captain there. I would certainly hope that my reputation over these last 18 years has proven my dedication to this job. I care about kids. I care about my colleagues. I care about our community. This year, by far, has been our most challenging to date. I'm not going to talk about the survey. You reviewed the survey. I'm going to instead tonight express a few concerns for me as a middle school staff member, specifically related to challenges that we are facing, and maybe open some eyes to the reality that we are facing every day, just through a different lens that we may not be aware of. First and foremost, I'd like to share, I'm a mom, I'm a mother too, of 2 children. I completely sympathize with parents of our community who wish to send their children back to school full-time. My 2 children are also on a hybrid schedule. I understand the challenges that come with that. As a mom, it is my job to support my children at home, which happens in the evenings. My husband and I both work full-time jobs. So after a long day of work, it is the last thing that I want to do at 7, 8 in the evening is to sit down and review schoolwork with my kids. But it's part of my job as a parent. I get it. It has been demanding. It's been overwhelming. So why then the push for Southwestern to remain in this hybrid schedule? The answer is simple. It's safety first. Until this pandemic is over, we all need to do our part to mitigate the spread of this virus. How do we do that? How do we keep our students and our staff safe? Social distancing is one of the biggest factors in preventing the spread of COVID. It is the very first question that our administrators come to our classrooms and ask us when there is a positive case in our school. They say, who was sitting within 6 feet of this child for longer than 15 minutes? Right now, thankfully, we're able to say, no one. Most teachers even, because we're mindful of that as we're circulating the room. Should we have a full-time return, looking at how many kids would be in the middle school classrooms, I would potentially be able to answer about 8 students that would surround that child's desk within 6 feet. Although we are doing justice regarding cleaning in our schools, less than 1% of COVID cases are coming from surfaces. This is an airborne virus. Most of what matters is the air that we are breathing. I will give you a specific example. The very first class that I teach of the day is a section of 30 students. Not one of them is a distance learner. Should we return full time, I will have 30 students in my room. 30 desks at most in my room will be about 2 feet apart. So to me, it is not a question of whether our cases, our quarantine numbers would increase. It's when they will increase. It is inevitable. Our middle school enrollment is the largest that it has been in over 10 years. Our class sizes are all close to 30, some are over 30. These 30, they're not in a cohort. They travel to 8 different classes throughout the school day, mixed with a different group of students every class period. Given these numbers and the fact that we simply cannot achieve social distancing, I find it hard to believe that we're all okay saying that one of the biggest safety measures simply doesn't matter anymore. Teachers didn't ask for this hybrid schedule to start the year. This was decided upon, and now we have done our best to make it work. We don't want this. We want our students back. We want your children in our classrooms. Our lives would be so much easier if students return to school full time. But what we want isn't necessarily what we need to happen and isn't necessarily the right thing to do. Teachers are putting in countless hours, more than they ever have, to make this hybrid schedule work. Teachers do what it takes for the sake of their students, even when it is harming our own social and emotional well-being, even when it is to the expense of our own families at home. We feel so strongly about the safety of our students and our staff that we would rather continue working in this model, as hard as it may be, than having students come back to the middle school full time. As you're aware, maybe you're not aware, we can hardly staff our building. Yesterday, for example, we were short 7 substitutes. Throughout the school day, 40 of our staff members had to go cover teachers' rooms for teachers being out, for some coaches leaving early. We don't have substitutes. Rightfully so. Substitutes don't want to come in and be, amongst a variety of students that they don't know. As teachers, we can't come back to work with any kind of symptoms. So again, a full-time return will increase staff exposure, causing even more teachers to be out. This leaves our students with some random staff members popping in and out of classrooms every 20 minutes or so to teach, whether we're qualified to teach that subject or not. That's what we do. We give up our planning time to go cover these classes. Let's talk about the active construction zone at the middle school. Okay, that's okay. This is sent to you. Thank you.
Mr. Brodette.
Thank you. Good evening. My name is Nathan Robeck. This is my 16th year as an English teacher at Southwestern High School. I'm also a 2000 graduate at Southwestern, and I reside in the district. A few weeks ago, I was asked to join the committee of administrators, parents, and teachers in order to open a conversation by creating and analyzing a survey sent out to our community members and staff. After reviewing our results and recent district-provided information, I am here tonight on behalf of not all of my high school colleagues, but many of my high school colleagues, to urge you not to reopen the high school in a full-time face-to-face model. In light of the process that I went through, it's evident, and you saw it in some of the statistics of the survey, that different schedules are appropriate for elementary and secondary levels. If we deem it necessary for elementary to have more full-time face-to-face learning, phase that in first. In the meantime, allow the high school and middle school to remain on our hybrid AB schedule with either the asynchronous day built into the week or the current model we are in. Allow our staff to connect with the distant learners and parents, collaborate with colleagues, and ultimately just prepare the lessons that we need at this time. When we look at the high school survey, all right, I think it's evident that it supports what I'm saying. So I just want to review a few of those numbers. I know we went over them, but a couple of things. So 79 of the 93 eligible high school teachers completed the survey. This shows to me that we want to support the safest route for our students' education. Please understand, teachers belong for the day, like Jen said, where we can instruct like we once did and have our students interact as they once did. Unfortunately, at this time, we all cannot return to the school safely. Of the 79 completed high school teacher surveys, 54 of those teachers, so that's 67%, do not support any type of full-time face-to-face scenario. To pair that with the parent survey, 49%, or about half of our families at the high school, concur with that. The majority of our teachers are conscious of the recommended guidelines from health officials, including the evidence benefit of social distancing. When you take away social distancing and other precautions, isn't it alarming that 58 of those 79 teachers, 75% of your high school teachers, would have constant worry for personal and student well-being, or would be hesitant but willing to do so if required? Also, 12 of the respondents, 15%, would pursue potential leave of absence options, and some would even severely consider the path to retire or resign. I don't want to belabor the point, but is our administration prepared? Is there a plan for the substitutes that would be needed in the event of those absences or resignations? To break it down further, only 6 high school teachers said they feel completely comfortable, 6, completely comfortable reporting to work knowing social distancing is not possible. If the staff survey truly has equal weight with its counterparts, we would not be proposing a full-time physical return for the high school. As we remember our students are the focal points, we must also consider the current hybrid learners who would be forced to shift into distance learning. Just last week I had a student tell me that if we would return to a full, he's a hybrid student, so he comes every other day. If we would return to a full-time model, his parents would force him to go distance. He was upset about that. He was upset about that. At least now he gets to come to school every other day and have those social interactions and that face-to-face learning. And lastly, let's consider the reality of our current situation. We have been receiving weekly, if not more frequently, phone calls from Dr. Burkhart alerting us to another confirmed COVID-19 case within the district. So as those numbers rise and more are exposed and tested, the recommendation tonight is to we want to cram more kids into spaces without social distancing and other recommended guidelines. Even 1 day a week of full-time face-to-face is unsafe, yet we somehow recommend 4 days of it. While we acknowledge that most students are struggling this year academically, no doubt, I heard Mr. Downs' numbers, that is staggering. We really need to think, are we willing to expedite the spread of the virus to improve the optics of our academics? COVID-19 has and continues to have a lasting effect. Thousands are sick and dying, and cases in our area rising by the day. Our main concern should be to educate our students in the safest environment possible and should include consulting and listening to medical professionals. PDE clearly suggests that either hybrid instruction or full-time distance learning be the preferred method of instruction in our area. We as teachers are on the forefront day in and day out, doing our job. I'm proud to be a Southwestern teacher and a community member, and I always will be, as I always have. We are professionals, and we will get the job done, just as we always have. However, I can't ignore the valid concerns of my high school colleagues who plead that a full student return is not the right thing to do at this moment at the high school. In time, yes, we will get there, but not now. Thank you.
Kelsey Diener.
Members of the board, my name is Kelsey Diener. I am a 10th grade student at Southwestern High School. Thank you for having me speak this evening. No, that's my answer to the question if we should go back to in-person learning with full classes. It's too great a risk for our community and for the people already putting their lives on the line to give us even some semblance of normalcy. When it comes to such a devastating disaster such as this, it wiggles its troublesome self directly into the fray of our already busy lives. We force ourselves to consider risks and rewards. On one hand, life must go on. Time stops for no one and the world still turns despite our little human catastrophes. COVID-19 is an airborne, flu-like pandemic that spreads through the air and attacks the lungs of its host. Now, this is incredibly troubling for people like my mother and I. We both have asthma, and catching the virus would be devastating to our already weaker respiratory systems and could potentially damage our lungs further. Despite this, I still made the difficult decision to come to classes on the hybrid model because though there would still be a risk of exposure, I could take the necessary precautions to keep myself and my family safe. The classes are able to be socially distanced as it stands, and I still get instruction directly from the teacher. In fact, I'd argue that I like the hybrid model more than the standard school schedule because I get more individual instruction in class and extra independent time to work on projects and homework. Tools and materials are more readily available to me, especially in hands-on classes such as woodworking, and the teacher can more easily tend to students who have questions. These are benefits that both full distance and full in-person schedules would lack. We are still seeing a large number of cases, and they are still on the rise. Increasing exposure coupled with flu season, which already brings plenty of disease, would not bode well for the health of our community. Not everyone follows proper mask and personal sanitation protocols either, from my experience, and I doubt doubling the number of people in our schools is going to generate any sort of gain. Teachers having to come into contact with multiple classrooms full of students each day are the most at risk, and should we increase the volume of students in schools. Plus, they would have a hard time sanitizing twice as many desks, tables, and chairs in the 5 minutes that they have to transition between classes. In the survey sent to members of Southwestern School District, the majority of teachers chose that they would prefer the hybrid learning model. This is partially because they are the most at risk should we add more students in the classroom. Graphs and charts of the daily influx of new cases generally show an upward trend as we dig further into cold and flu season. Should we go back to school, we would see an exponential increase in positive cases. A full-time distance model would function to preserve the health of the community, but it would impede the ability to learn far too much for most students. For one, hands-on technology and engineering classes would be completely cast aside. Most students only have access to the tools and machines necessary for those classes in school workshops. They will be forced to do textbook or PowerPoint learning, completely deviating from the important skills the students would learn in those courses. In addition, classes that base most of their learning on discussion, debate, and development of ideas would get the short end of the stick too. Students are more likely to be tempted to distractions when at home, where the teachers can't monitor the behaviors as closely. I'm sure it's been a while since most of you have been in K-12 school, but we don't exactly have the reputation for being focused and attentive 100% of the time. I'll admit, it does get very tempting to peek at my phone during a boring lesson, but with most instructional days being in person and home days being reserved largely for independent work, it's a lot easier to regulate my own distractions and keep track of my time and work. Also, being completely out of school often causes kids to turn into escapism. Without their problems looking them in the face 7 hours of the day, it's easier for them to avoid them entirely. This was a pitfall I ran into last spring. The shock of such a different system, coupled with my own ineptitude at handling my assignments and technology on my own, caused my grades to completely tank. There was no way to translate my hands-on internet engineering design class to a fully digital setting, and many of the projects had to be scrapped because the full-on distance schedule made it impossible for everybody to get the tools and materials to complete them. Full distance learning would not fit most students' classes and learning styles, so we shouldn't force them into that option unless absolutely necessary. I'd like to note that this has all been churning it over in my mind since the spring. I caught word about this board meeting at exactly 8 p.m. last night and prepared this letter before 9 in an hour. And immediately felt the need that I feel passionate about this. It's time to take a stand and say how I feel about this as a student. I feel like I speak for many when I say it is a terrible idea to force people to either choose between a disease-ridden in-person schooling and a full, no-contact distance learning style. The risks are too great, the rewards are too few, and the gamble is not worth the potential lives we may lose due to poor planning and a hasty attempt to return to normalcy. The safety of our community should come before our trivial daily proceedings, and we should not force our students into a schedule they won't be able to learn safely and effectively in. Thank you for listening.
Matthew Delanza, I apologize.
Good evening. First off, I'd like to thank the board as well for the opportunity to speak tonight and acknowledge you've gone to great lengths to survey the parents and teachers and establish the committee to examine this in depth. And it should be recognized and commended. And reading your recommendations from the committee presented to the board, I find that the 4 days of learning is laudable, but not ideal. I recognize the board is faced with tremendous political pressure, as well as pressure from some of the more fearful on community and staff, which is why I'd like to highlight some of the facts that have largely been omitted in the coverage of COVID-19 and the dangers it poses. We need to first refocus this decision on whether it's a danger to our children. As the state considers anyone under the age of 19 a child, I'd like to first cite 4 very important critical statistics as reported by the American Academy of Pediatrics last Thursday. They analyzed 42 states, including PA and New York City, and reported the following. 0.2% to 8% of all child COVID cases resulted in hospitalization during their state. Hospitalization rate of all children with COVID-19 infection has steadily decreased from 3.8% overall in May to 1.4% this month. Of all COVID-19 reported deaths reported by 42 states, 0 to 0.24% of the deaths of COVID were child. The Pennsylvania specifically had a child confirmed infection rate of 650 per 100,000, which is approximately 10% of our population. So currently, of the children who can contract COVID, we only expect approximately 1 to 4% of these children will be hospitalized, and under 1/4% will succumb to it. On the CDC website, the death total for all COVID-19 from February to 2 Saturdays ago was 198,809 people. Children under the age of 14 totaled only 72 deaths out of a population in that age of 60.5 million people under the age of 14. Children aged 15 to 24 accounted for 369 deaths in a total population in that age group of 42.6 million people. The argument that school is too dangerous to the children is entirely false when considering the statistics and considering against an effective education. The danger to children with COVID is actually decreased, as evidenced by the average hospitalization rate decreasing. I would postulate that it's very possible our children have silently already become infected and developed immunity, which would account for lower rates of hospitalization. Which brings to the second point we have to consider is the adult contact. So we've covered children in schools. The other question is, what's the danger to the adults in our schools? And I would proffer this. If the child infection rate is 10% of the total population, then considering the adult population would be the other 90%, being in a school full of children is significantly safer than being in our grocery stores. As I myself have been a public servant, police officer for the past 25 years, asked to be out in public during the COVID crisis, I'm not asking any more than has been asked of me when I asked the board to reopen our schools and require its own public servants to return to our schools and hazard the risks and continue to provide the excellent level of instruction they did before the COVID shutdown. Those who are still in fear after considering the aforementioned statistics should be allowed to opt for the less effective virtual learning, while the rest of us continue to place importance on education, braving the hazards of a real world. Catering to the meek among us does not carry on our proud tradition of perseverance under any circumstance. And in hearing the discussion tonight, I wanted to address two more final points. And that is, if we were to have asked our staff in our surveys if they would have considered virtual learning as effective as face-to-face learning, I would venture to say the percentage of not as effective would have been well over 90%. We're not arguing that here. I found it shocking, the statistics, the fail rate was presented by Mr. Downs tonight. So the choice here we're making is whether we continue to educate our kids effectively and whether we allow the threat of this COVID to stop us from doing that. And the last request I would make of the board is, if we're going to make announcements of a new case of COVID-19 in schools, we should also include whether it's symptomatic, asymptomatic, and whether it resulted in a hospitalization. As is normal with COVID infection, and I know several people who've gotten it, you get flu symptoms, you get better, and life goes on. Thank you for your time.
Good evening. My name is Doreen Graff, and I'm a bus driver here at Southwest. I'm here to speak on behalf of many drivers that have serious concerns regarding the proposed reopening plan. First, I would like to say that we are hoping that the board does not approve the plan and decides to leave the hybrid schedule as is. We understand the hardship that many families are experiencing right now and their concerns regarding the education their children are receiving. We're not here to argue that point, and we understand that your decision will not make everyone happy. This pandemic has created a no-win situation for all. However, with that being said, we need to make sure you understand the concerns we have as bus drivers in this district. Our voices have not been heard. We have not been asked our viewpoint. We have not been asked about our concerns. We have been told since the beginning of school that they have no answers to our concerns and that they are looking into them. As of this date, no one has gotten back to us to address the concerns that we've had since the beginning of the school year. But we took a leap of faith and came back willing to do whatever was necessary to get these kids back in school where they belong. But once again, our voices are silent. Once again, decisions are being made that affect every one of our drivers, and at no time has anyone ever asked us how we felt or what our concerns are. We are not taking a leap of faith anymore. We want to be heard. So first, this proposal goes against the recommendation of the PDE and the CDC. How can you think that this is creating a safe and working environment for us? You are telling us to transport all the kids that plan to return full-time, regardless of the numbers. If we double what a lot of our buses carry right now on an AV day, some will be carrying over 60 kids. We currently have the first 3 seats blocked off to allow us to socially distance from the students. We load our buses from back to front so that the kids that are on the longest are further away from us. Is that even going to matter anymore? Many of our kids take the masks off or are not wearing them properly. And we can tell them and remind them constantly, but other than that, there's not very much that we can do. Many come to school with ill-fitting masks or masks that are all stretched out. I personally have bought child-side masks that I give out to the kids, when theirs does not fit properly. In 5 weeks alone, on my bus, I had given out 33 masks and 3 face shields to students because they either came to the bus without them or theirs was not effective and not fitting properly. But then again, is any of that going to matter, since basically they're going to be sitting on each other's laps? We are told that we may have to give up our seats, those 3 seats, if needed, in order to accommodate those students. We are not willing to give up those seats. We want and we need our social distance. We are older, there are underlying health conditions, and we need to be protected. So now what happens if we refuse to allow students to sit in those seats? Will we be reprimanded or forced? 3 in a seat for elementary is not a huge deal because they're small. But for older students, it is an issue. Another point is, why is it not okay to socially distance in school or on the buses? Well, we have to hear it right now. At our sports events, we have to social distance, even if it's outside. What's the difference? What happens when it's bad weather outside and gets cold? Our windows and roof hatches will need to be shut, which are now open to allow airflow and air circulation through the bus. There will be no airflow. There will be no circulation going through. Again, this is part of the PDE recommendations. Though it is not fully enforced in bad weather and winter, it is much safer with less students than a full busload. When the surveys were sent out to the families and the teachers, we were not included. No support staff was asked to complete a survey. Again, another example of our voices not being heard. This directly concerns every support staff in this district, and our safety is not important enough to get our input. With the results of the survey, it is our interpretation that the majority of the teachers were not in favor of this proposal. Why are we allowing parents to dictate our reopening? When is it acceptable to put everything else above safety? Not just the safety of us as drivers, but the safety of every district employee and every district student. When school opened this fall, we had 3 positive cases that shut us down for a week. We have now had 6 within a little over a week, and we did not shut down. What has changed in regards to the criteria of shutting down? Our numbers are going up. When students are quarantined or test positive, why are we not notified as bus drivers? We do not know who should not be getting on our buses, and that is an issue. How did we get from a couple of weeks ago wanting to keep the hybrid and shutting down for an extra virtual day so that students that are at risk can be worked with by the teacher to now wanting a full-time opening? So as the old saying goes, actions speak louder than words. I hear you saying that you are doing your best to keep us all safe, but your actions and your decisions say otherwise. We are not asked about our concerns. We are not asked about your decisions and how they impact us. We are not asked what can be done to make us feel safer. We have lost faith that you care about our needs. We have lost faith that you care about our safety, and we have lost faith in the school district. Thank you.
Good evening, school board members. Thanks for hearing the parents out. I listened to all of your information, and I have numerous concerns and several observations based not on me opining, but based on the district's information they provided. We're all going to interpret what we see in our own way, but this is what I'm hearing. The teachers overwhelmingly support district learning and hybrid learning and do not want to return full-time. The parents are split on that issue. The teachers are worried for their safety of themselves and their students. Not just worried, they're going to constantly worry about it. And what I find particularly breathtaking is 10% of the teachers that were surveyed said that they are going to take a leave of absence, resign, or retire if we return full-time. Now, if you extrapolate that number, that's 30 teachers we're looking at filling the gap. We don't have enough substitutes now. We don't have enough certified, qualified substitutes right now. You're going to have 30 teachers leave. We've already heard that you have 7 classrooms that have gone uncovered at the middle school because they don't have enough staff. We've had 35 teachers who have been self-quarantined. They're not available. Then you run into the normal day in, day out of teachers just having, they're unable to come to school. What should we be expecting when we return full-time? The teachers aren't going to be there. The students are going to come in to find that the classrooms aren't staffed, and they're going to be doing online study without the social distancing, and they're going to put themselves at risk. My other concern is my concern is the safety of the students and the teachers. A full return means no social distancing. What would have helped me tonight is if we could have had an example up here of how the kids are protected under social distancing and what we're now going to be in for. So I did my imagination ran on its own. One kid in the classroom gets contaminated and has COVID. He has 4 classes. The kid in front of him, behind him, to the left and to the right of him now have to get quarantined. Times 4 classes, that's 16 kids that now have to get quarantined. On the bus, that's the kid in front of him, the side and behind him. One kid just wiped out 20 kids because we're not social distancing and now they have to be quarantined. Just one COVID case. We're looking at abandoning this plan at a time where the district said the number of cases are going up. Now when these kids, when we get multiple, parents are expecting to go back full time, but we start getting multiple COVID cases in the classroom, then that means we're going to end up shutting down classrooms, shutting down buildings, shutting down the district. For parents that are expecting to go full time and this thing blows up, the parents are going to get the opposite. They're going to get distance learning and we're going to go back to all our students are going to have to do online studies until we can reopen up the buildings. My final problem I have is I came in, I listened to you guys in July, you pitched a hybrid thing to me. I wasn't sold on it, but I listened. Safety of the students. Every time I get that robocall from Dr. Burkhart, is this the one where we're shutting down the school? We've been able to avoid that with distance learning. I don't think we're going to be, when I get that robocall, I don't think we're going to be able to avoid shutting down the schools because there's too many kids are going to be on top of each other. How do you trace it? How do you track it? Who gets quarantined? My opinion is, we're in no rush right now. Why are we doing this mid-semester? We have time to do it. Parents have time to prepare. It's too disruptive right now. I've got to now adjust after 2 months of my kid doing well with his teachers. Now I got to figure out where am I going to go? Is he going to distance learn? Well, I got to roll out the Southwest Academy because that option is no longer on the table. I'm not going to be able to get him in a cyber school because we're switching the plan mid-semester. But you're asking the parents, when we make this decision coming up, to hold firm on the decision we make. We're just moving too fast. I think we need to slow it down. We need to build some consensus. We need to listen to our teachers because the teachers are the ones that are going to carry this plan. And if we don't have teachers in the classroom, what's the use of going back full? That's my 2 cents. Thank you for listening.
Jennifer Lang. Robin McCullen. Kelly McNeil. Kevin Rickroad.
I have two students that attend Bearsville Elementary, which my wife and I love very much, and we have a lot of respect for the Bearsville team. And we basically are here to urge you to go through with this recommendation so that our children can get back to school. I have a first grader who I told him has the possibility of coming back to school full time, and I said, you're gonna get to beat the rest of your class. He said, what do you mean the rest of my class? And he just started naming all the kids in his class. I said, no, there's another half of kids that you don't even know. You've never even seen them. And his face lit up, as happy as could be, knowing that there's more kids that he can become friends with, get to interact with socially. And that's important. As almost equally as important as the educational side of it is the social. And he needs that, and my other son needs that also, as do most of our children. He also has been in school for 15 days this year. That is it. He missed 2 days because of a mild cough, and he is not getting the proper education that he could be getting, being that he's only been there 15 days. We have parent-teacher conferences coming up shortly, and we're going to be meeting with a teacher that has only had my son in the classroom for 15 times. And to me, that is unacceptable and absurd that he's only attended school 15 days. Our kids are on an educational journey right now, and in a very important part of their life. Their brains are ready to be molded at this young age, and they need to be taught by teachers, not myself. I'm not a teacher. I would rather have my kids be taught by a substitute that comes in or another teacher that's covering the classroom that is also a teacher than be done by myself, who's not a teacher. Most of the kids, and mine included, do not behave quite the same as they do in school for their teachers. It is a struggle to teach your own child after getting home and getting them to be able to pay attention like the teachers do. We get told that we're not their teachers, they listen to them better. And in my opinion, that's who they should be taught by. Not by parents, not by grandparents, not by daycare centers, by the teachers. We do all that we can to support the teachers of our students, as many people do. We're willing to help and do anything we can, extra at night and so forth, is what we need to do. And that's what all people are willing to do, is to help and support, not be the teacher. Also, when I'm listening to everybody and they talk about how this reopening may not work and we're going to end up being shut down, I look around at neighboring schools who are doing this exact same thing and yet are not shut down and have not been shut down yet. So why would we be any different? Will cases increase? Sure, they may, but as we've heard from the statistics, they're very minute. And I think that we are taking it a little overboard in some scenarios, and the percentages are low. We're going places besides school. Like, when we're not in school, my kids go other places, we're all going other places. We're not socially distancing every single place we go. I see people out, everybody out, doing their own thing, playing sports, baseball, basketball, anything that's going on. And we seem to be okay. I think it's time for us to be able to move on, to accept what we have here in front of us, and to get our kids back. Clearly, by the numbers that we've been told, our students are failing in this model, and the numbers show that. To me, I want my kids to get a great education more than anything. So I think that we need to push this recommendation through, get our kids back into the classroom, and get our kids back on the straight path so that we don't have so many failing scenarios. Thank you.
Allison Warehouse. Allison was the last person on our list of those who reached out ahead of time to speak to the board. Again, at the end of our meeting, the door will be open to any others who haven't already commented tonight. I want to give the board another opportunity for questions, comments, reflections.
The criterion for moving forward. Currently, we are following the PDE, Pennsylvania Health guidelines as far as if and when there are cases, as far as what we're supposed to do with buildings, quarantining, closing, going distance learning. What is that criterion? And I guess specifically my question then would go into this fourth slide, the PDE recommendation for instructional model. So if we are continuing to follow those guidelines for when there are cases, when they arise, why are we doing
Could you repeat just your last question?
Yep, I just asked, I draw attention to the fourth slide here that says PDE recommendation for instructional model with our moderate community transmission spread is a hybrid or full remote. So if we're following the guidelines for when there are cases, why would we deviate from what they're recommending?
The answer to that would be, if you recall the last board meeting, the proposal was put forward for the teachers to have 2 days face-to-face and then add an extra asynchronous day. We heard from our community, we heard from our board. The board decided to table that motion and ask the survey committee to come together. So they charged with putting together the committee. We did that. We now have input from our families, similar to what we did at the beginning of the year. To Mrs. Berger's point, the recommendations haven't changed since July. One of the things that when the survey came out was, it said something to the effect of, when the people voted to go hybrid, they voted to go hybrid because they didn't want to wear a mask. And then the masking order came out about a week before school, and people had asked why we weren't resurveyed, because many would have indicated that they wanted to return in a face-to-face model because they now had to wear the mask and that was no longer a choice. We didn't survey at that time simply because bus runs had been done, cafeteria, everything was completed and ready to go. I don't want to say it was too late, I think anything was possible, but at that point, we moved forward with the social distancing. So one thing that PDE will tell you, and what the Department of Health will tell you, is everything they tell you is a recommendation. So the district takes the opportunity to follow that or not follow that. And so while social distancing is certainly a critical component in mitigating the spread of this disease, I do want to point out that our district has done, I have a form up here, CDC says you should consistent and correct use of masks. We do that. If kids aren't doing that, then the administration needs to know, because we made it clear that masking is required. That is an order, and our attorney is up here tonight. He can tell you, the order from the governor is a law. So we don't deviate from the order of masking. We do have some flexibility with recommendations. CDC says social distancing to the largest extent possible. In some classes that's 6 feet right now, in some classes that's not. I know some of our teachers are still doing group work, and I understand why. That's how kids will invest in that teaching. And hygiene and respiratory etiquette, we do that. We do that regularly. Cleaning and disinfection. Mr. Osborne and his team have done an outstanding job with that. And then contact tracing in collaboration with the local health department is something we do on an as-needed basis, which if we have a case that we suspect, we contact them. There are suspected, there are probable, and there are confirmed. Suspected is someone who's showing symptoms but has not been in touch or in contact with anyone who's considered a confirmed or probable case. A probable case is a student or an adult who has been in contact with, or close contact with someone who is a confirmed case, and obviously a confirmed case is a confirmed case. So all those things are considered, and all those things have to happen in order to make the decision. A lot of people have been asking, without sharing too much information, about why are we not closed. Many of the cases that are being reported to you are considered household contacts. They live in the same house. That is not community spread. So those are some of the details that, while we don't put it in the message, we are in constant contact with the Department of Health and following their guidance. So to answer Mrs. James' question, why are we deviating from it now? We surveyed our parents, we surveyed our staff. We have a dichotomy, they split, one response one response the other. And from a personal perspective, when I hear the academic numbers, I'm concerned. I'm very concerned. So it doesn't mean I dismiss or do not take seriously the threat to our families, because those kids go home to the families, to our staff. A lot of people have mentioned that they have secondary conditions. I do as well. I understand the risk, but I also have had numerous conversations with our faculty, with our faculty, but also with our departments and our supervisors. And we're committed to safety. So if the board elects hybrid, we'll be committed to safety. If the board takes the recommendations from the committee and they go full-time, we're going to be equally committed. I don't remember what speaker spoke that said there's a chance more kids will be quarantined. There is. And no one's disputing that. And at the risk, I don't mean to sound dramatic, I'm not trying to bias anyone, but there's also a risk that our failure rates will continue to rise. And that, as a superintendent of schools, I have no easy answer, and I have no right answer. And I don't pretend that I do. All I have are difficult answers. But at this point in time, our children are not driving. They're not. And something has to be done. And if that's modifying a hybrid, if that's the way the board goes, then we'll do that. If bringing them back full time, we'll do that. But our administrative team collectively told me something needs to change. And that's why we're here this evening. So the recommendation from the state has not changed, but the information that we have since the beginning of the year has. That's where we're at right now. So I apologize for the lengthy answer, but there's a lot of background there that helps arrive at that decision.
Any other questions from the board? It's okay.
With cold and flu season quickly on us, the way that the board votes this evening, does that necessarily mean it's an end all be all, or can we reassess this? Can we look at it in January?
That's any change under the guidance from the state, under the phased reopening plan, and as we saw, it's always at the discretion of the board. You can tell us to consider it at any time. It's truly at your discretion. We cannot make it. The administration, and I'll ask our solicitor to weigh in on this, but we can make a temporary change, such as a 5-7 2-week closure if there's an outbreak, but we cannot change to a permanent. You can't go permanently full-time face-to-face or permanently full-time distance or even hybrid without your approval. It has to come to you for consideration.
Can you hear me now?
Into your mic.
In regards to the busing situation, what is our protocol if a student needs to be quarantined because they have been around students that they're not socially distant? Obviously, on a bus ride, people can be together for 20 minutes side by side in the seat. What has been our protocol? What will be our protocol from this point forward? Students that are without COVID and people around them?
So if they come down with COVID, they are quarantined. Isolate for 10 days, and then those around them are quarantined for 14. So if there's a student within 6 feet of that child or staff member, and within 6 feet of that child, they would then have to quarantine for 14 days for an onset of symptoms at that time. They obviously still remain symptom-free to return to school at that time. As far as the notification of the drivers, typically Dr. Coots works with the building principal, and they disseminate the information. So I can ask our building principal to speak to that. I am not involved in the notification of the building principal. I'm part of the consultation with Dr. Coots. We review the Department of Health, and then that goes forward from that point.
If they are at risk, they will bring everything with us.
Oh, absolutely.
have a suspected case, Brian Burrell is emailed, and he actually goes on and checks video on the buses. And then we have a workbook where we keep the names of those suspected cases listed in case it is determined that they are a positive case, which then would require us to act on that situation. So we do go back. That's part of the whole contact tracing process, in which the bus is a big part of that. And we get emails from him constantly. No, there was no one sitting in the seat. The student was only on the bus for 5 minutes, or the student was on the bus for 15 minutes, and so did that for within 6 feet.
I want to share, I have a lot of thoughts. As we've said since probably before July, the situation at hand, when we think about public education in light of COVID, there are no perfect solutions. There's nothing that fits us ideally. I hate to say this, but I feel like on some level we're put in a position where we have to choose the lesser evil. I've received, I can't count the number of personal contacts I've had in the last 3 weeks. Whether through letters, mostly through email and phone calls and messages. And I have to say that by far the most people who have reached out to me personally have been concerned for their students' safety. And I think we heard that tonight. At the same time, we see the survey results from the families. This is a really difficult situation. There's no way around it. I want to address a couple of things that were said tonight. Many of you know my husband is a part-time support staff member. My husband is also someone who's in a susceptible category when it comes to risk. So please know that this is something that I, and I feel the rest of the board, take very seriously for every single member of this team, every member of this community. I thought a lot about what Kelsey said and what Mr. Brobeck said. I think about my own personal situation, my own son who graduated several years ago, and what I would want for him and what I would do. And I can definitely relate with the situations you described. I don't know that I feel comfortable having my son 5 days or 4 days a week. And I think about, Kelsey really described well the pull that a lot of families are having right now and the decisions they need to make, and it's very serious. You get one shot at high school. With all of that being said, when we come back to the data, we have to do something academically. We have to make a change. Something needs to happen. What Mr. Downs shared, what Dr. Smale shared, it's shocking. It is shocking. And I feel like, as uncomfortable as I may be, we're at a point that we need to stop the bleeding. We need to do something. I appreciate the point that was made about the fact that we're in a position that we have to continually reassess. We have to look at what's working and what's not. This is not something that we can say, okay, as of November 2nd, this is how we are, and that's what we'll follow through. We don't know what lies ahead. We really don't. So I wanted to share that, and I want to thank each of you who are here tonight and those of you that are watching. I appreciate your involvement in the community, your involvement in the district, and your support of our kids and our staff. Do any other board members have any questions or comments?
We must do something, but I hope everybody understands that whatever we do, we going to be monitoring it constantly. And if a change is indicated, we will do that at the time. We don't have any other choice.
Would anyone like to make a motion to move forward with recommendations from the administration? Mr. Plessick made a recommendation to move forward with the recommendations from the administration. We have a second? A motion and a second. Any final comments or questions? Roll call.
Mrs. Boyer?
Yes.
Mr. Harris? Yes. Mr. Lockman? Yes. Mr. Mummer?
Yes.
Mr. Plessick?
Yes.
Mrs. Rinker?
Yes.
Mr. Wright?
Yes.
Mrs. James? Mrs. Berger? 8 yes, 1 no.
Thank you all. Dr. Burkhardt, I wonder if you want to talk about continuing communication.
Next step will be the administration, principals will meet tomorrow morning. We will work on a form that we can distribute to our families. They will receive it either tomorrow evening or Friday morning. We would ask them to consider that over the next several days, and the sooner we can get it back, the more readily we begin making preparation for the next step. And once that's done, we will be able to schedule changes to the agenda as they're completed.
All right. Move on with our agenda. Section 5, additions, deletions, or modifications to the agenda. And I do believe we have additional action items in the building grounds.
Yes, that's correct. Here are some of the change orders and related to instruction at the middle school.
All right, matters for which board action is required. We'll begin with personnel committees.
Bear with me, please. I would like to start my motion by, under the personnel section, to honor the leaves requested by Denise M. Pelt, student achievement coach at West Mannheim, requests leave of absence under the provisions of the Family Medical Leave Act from October 28th until approximately December 10th. Next item is Jenna A. Johan, mathematics teacher at Southwestern High School, requests a leave of absence under the provision of the Family Medical Leave Act from on or about January 7th until April 1st. January 7th, it should be 2021. Is that correct? Instead of 2020? Help me out, Dr. Burkhardt, is it correct?
Yes, you are correct, Mrs. Rinker.
Pardon me?
Yes, you are correct.
Okay, so it's January 7th, 2021 until approximately April 1st, 2021. And an extension of the leave from April 2nd, 2021 until the end of the 2021 school year. The next item under 2 under employment is the professional personnel. Item A1, we employ, I would like to add to the Lauren E. Krentler, long-term substitute for grade 2, effective retroactive to August 19th, 2020, for the remainder of the 2021 school year. This is a letter of agreement with her initial assignment at Park Hills Elementary School. Excuse me. Item 2 is the employment of Kayla C. Johnson, long-term substitute, part-time science teacher, effective October 15th, 2020, for the remainder of the 2021 school year. And her initial assignment is Southwestern High School. Then item B under employment is day-to-day substitutes, Tiffany M. Dussman and Jody L. Ziegler. Item C is employment of support personnel. Shannon J. McNeil, part-time receptionist, effective October 19th, 2020. Initial assignment, Emory H. Markle Middle School. Item 2, Dorinda K. Hammond, part-time library aide, paraeducator, effective October 19th, 2020. Initial assignment, Bearsville Elementary School. Item 3, Tina M. Poole, full-time custodian, effective October 12th, 2020. Initial assignment, Emory H. Markle Middle School. Item 4, Glenda L. Niederer, substitute custodian, effective October 19th, 2020. Item 5, Teresa M. Bolton, part-time paraeducator, effective October 19th, 2020. Initial assignment, West Manheim Elementary School. And item 6 is Miranda, M. Niederer, full-time custodian, effective October 15th, 2020, the initial assignment being Southwestern High School. Item D is game help. We would be hiring Wendy S. Curry. Those are all my indications for employment. I just need a second.
Motion is second. Any further comment? Roll call.
Mr. Harris.
Yes.
Mr. Lockman.
Yes.
Mr. Mummers.
Yes.
Mr. Plessick.
Yes.
Mrs. Rinker.
Yes.
Mr. Wright. Mrs. Jinks. Mrs. Boyer. Mrs. Berger. 9 yes, 0 no.
To list so that Mr. Mummert has it in his minutes, the resignation of Blaze T. Ravel, in-school suspension coordinator from Southwestern High School, effective October 9th, for another position. The resignation of Austin G. Kress, custodian at West Manheim Elementary School, effective October 12th, for another position. Melanie M. Berkheimer, part-time food service, Emory H. Markle Intermediate School, effective October 2nd, for another position. Christine L. Callahan, part-time paraeducator, Bearsville Elementary School, effective October 8th, for personal reasons. And Tiffany L. Groff, part-time food service, Southwestern High School, effective October 23rd, 2020, for personal reasons. And that would conclude the list of resignations.
Building grounds and equipment committee, Mr. Mummert.
Thank you, Ms. Berger. I'd like to make a motion for agenda items 7B, 1, 2, and 3 for approval. These are change orders and things that were discussed at our building and grounds meeting this past Monday. We got it from the general contractor and the mechanical contractor, so they can get it, go ahead with the project.
Roll call.
Mr. Lockman.
Yes.
Mr. Mummert.
Yes.
Mr. Plessick.
Yes.
Mrs. Rinker.
Yes.
Mr. Wright.
Yes.
Mrs. Jinks. Mrs. Boyer. Mr. Harris. Mrs. Berger. 9 yes, 0 no.
That's all, Mr. Berger.
Thank you. We have one additional item in other matters for board consideration or action, and I'll ask Ms. Hayes.
I'd like to make a motion to approve item 7C, number 1, adoption of policy number 718 with one edit.
Second.
Any additional comment about that?
Yeah, we worked on that with Dr. Leader, and we're hopeful to be able to introduction to the dogs, particularly come in as a care dog.
Mr. Mummert?
Yes.
Mr. Plessick?
Yes.
Mrs. Rinker?
Yes.
Mr. Wright?
Yes.
Mrs. Shinks? Mrs. Boyer? Mr. Harris?
Yes.
Mr. Lockman?
Yes.
Mrs. Berger? 9 yes, 0 no.
Moving on to proposed October 28th, 2020 agenda items. We have a long list of final adoption of policies. Any comments from the administration?
I know a lot of them are updated, the buildings that are going to be required, and they obviously they need to be looked at on a daily basis for numerous reasons. So I would say, other than the board doesn't have any questions, really no additional updates that I would or share with you this time.
You have them available at the office or on file?
Yeah, right, and then they'll be attached to the next agenda as well.
Any items for planning discussion? No.
The planning is the next meeting, I would anticipate would be typical information that I hopefully some personnel that planning to make those.
Do any board members have any items of correspondence to share? At this point, I'd like to give an opportunity for any visitors, anyone in the audience who'd like an opportunity to address the board. Please come to the microphone again. If you have already spoken tonight, you have your turn. Try to do 5 minutes per individual who'd like to speak. So if there's anyone, please approach the microphone. Mic is yours.
All right, very disheartened with the decision. My phone is blowing up. I'm president of the association. This is not okay. So many staff members are upset. We can't keep this up, and we are now fighting. If we're going to be like that. I was in a New York County meeting prior to this, and they were all in shock because neighboring district Southern won't even recommend looking at opening back up until January at least. And here we are. The bus drivers, look at Central Dauphin. They went for full time, and they're closed this week because the drivers can't drive the kids. So that's all I have. But no, this isn't over. And we're not done fighting to make sure that we're safe to be here to teach the students.
Really disagree with this decision. I feel like there's only one person that voted against this, and we've had so many teachers and students. I'm pretty sure I'm the only student that actually came and spoke my piece. I'd like to also note something that I didn't say before, that everything that I know about the current situation has come directly from my parents, because students in high school, I feel like we should be receiving a lot of the same emails about the situation that our parents and our teachers are receiving, because for a lot of us, we're starting to get more involved and we have the power to know what's going on in our community. And I believe that we are just as much at risk, if not more at risk, than our teachers here. And I feel like my life and my health are being put in jeopardy for this situation. I feel like the proposal is either a binary, we're staying home, we're blending it together, or we're coming to school full time. I feel like there's still things, there's other small things that we could do to contribute. Like if we had a plan for students to get in contact with counseling more easily, if we made that more readily available for those who are failing their classes. I understand that something needs to be done, but I don't think just immediately turning into the status quo before quarantine began, I don't think that is the most effective thing to do here. It puts too many people at risk, and there are people such as myself who are already making a hard decision to come to school because we don't feel safe. There are so many of my peers that do not follow the mask recommendations. Like, kids walk around the building, the hallways are too crowded, even with half capacity, and I put up with that because I need to be in school. There's not a lot I can do, especially with there are certain students that are taking classes that they have to be in school. Kids who are in tech ed classes, technology education, students who don't have the resources at home to learn. We have to make that difficult decision to come into school. On a full-time in-school schedule, there are too many people being put at risk. It's dangerous for our teachers, it's dangerous for people who have pre-existing conditions, and I feel like there are still more things that could be considered, that could be done before we take such a leap to completely disregard all of these recommendations and guidelines.
By now, I've spoken several times, and I don't have anything prepared. I felt like I said everything I needed to say before. However, I just want to speak to the teachers at Southwestern and the support staff and the administrators. I know this is difficult. It's difficult for everybody, and I don't think that as parents, we're going to walk out of here celebrating that, what we wanted has happened in terms of the group I'm working with. It's sort of like, as Dr. Berger put it, or Mr. Berger put it, it's a lesser of two evils. And I think we all, and I hope that I can be correct in saying that we all want what is best for kids. I think we all can be united in that. We see that happening in different ways. But I go to work every day in a school building with all of my colleagues that I care and love, care for and love, and students that I care for and love. And we are okay. I think there's a lot of fear and change and the unknown that just makes it difficult for those who may be wrestling with this at the moment. But there are other districts doing this, and there are other districts who are okay. They're okay. So to the teachers that have fears, I understand. I have other colleagues that have pre-existing conditions. They've had to take a leave of absence. We have sub shortages. The challenges are great. However, like always, I think our teachers, our administrators, our board, and our community can pull together and do what is best. The best that we can do in the moment that we have. So I just am thankful for all of you, including the teachers who may not agree with me. I'm thankful that you're there every day teaching our kids. I'm thankful for all workers who are there serving me and my kids. I'm thankful for the doctors that are going to work every day and serving me. I'm thankful for the grocery workers who are showing up to work and providing me food. You know, things are difficult, and we all have to struggle with our fears of the unknown and the difficult time that we're in. But I think the more that we can pull together as a community, as a school, with our parents, our teachers, and our community to support one another, I think we can all get through this. So I thank you, board, for listening, and I thank you, teachers, for the job that you're doing. I know you're doing amazing work. And I thank you, administrators.
Good evening. My name is Mr. Murphy, Jeff Mordell. I teach at the high school. I just have 2 comments and then 1 question. First of all, to the student who spoke, I believe you said you're in 10th grade. Your parents should be very proud of you. The comments you made were some of the best points made by anybody tonight, both times you stepped up that microphone. So, you know, you should be applauded. Secondly, I'd be remiss, nobody has pointed out the contradiction of all of you standing up there, sitting up there 6 feet apart, yet you want to cram tons of students into our classrooms and putting them closer together than what you are showing an example tonight. Think about that. You're sitting there 6 feet apart because that is what's recommended. But then you're going to put students 2-3 feet apart in classrooms. I just don't get it. Why don't you sit right next to each other? Do what you're going to do with our students. And the question is, what about lunch? How are we putting this many kids in the cafeteria where they're supposed to wear masks, but yet they have to eat lunch? So I just have that question. I have a lot of concerns about this. Thank you for listening.
Keith Gilmer actually signed up to speak before the meeting, but I guess my name is First of all, I appreciate you both tonight. There's no way to tell us right or wrong what to do. And that's really what it comes down to. I do have one major concern as far as the teachers. It's concerning the difference of the teacher population in one system compared to the parents. You know, a month ago we were standing here trying to do away with another day at school. And listening to the teachers back then, talking to several teachers here lately, one of their biggest concerns is not only safety, but the biggest concern also is the amount of burden that they have. Trying to teach the AP kids the all-day virtual, you know, when are we going to start planning for stuff instead of reacting? You know, there's teachers that are teaching different things to learners at the same time, and it's overwhelming. That's one of the biggest complaints. There's school districts around us that have full-time virtual teachers that are teaching from home. They chose to teach from home, and they take all the kids in that grade and they put them aside that teacher. Why are we thinking out of the box? We started to do something like that. The other question, we talked about social distancing. You know, again, you know, with buses. My mother was a bus driver for 30-some years. We can't let them out of the loop. She should be buying masks out of her own pocket. You know, we should be coming up with a plan. Hell, I'll buy masks. I'll give them to the bus driver to figure it out. Another concern, I brought this up several months ago. You know, what's going to happen to our number of soccer teams whenever this vote happens, or right this time? So I asked 2 months ago, can anybody tell me how many kids are currently enrolled in LIU right now? 85. I called LIU today. That's over $500,000 that our district is paying out for soccer. Then the number that I don't know, because I have no access to, is how many kids are enrolled in soccer school outside of LIU? And is that number going to start going up? We as taxpayers need to be prepared for that. How are we going to pay that bill? So, and again, I love the fact that 10th grade students up here spoke. You know, but I will say this, and I know Mr. Downs talked about failures in school. I know some of these kids that are failing classes. And I'm telling you right now, it's not is give them an opportunity for them not to come. You know, so how do we get past that? I don't know the answer to it. But those are things that we need to be thinking about going forward and start planning instead of reacting. That's all I got.
So, my name is Kelly Duna. I'm also a teacher down in Maryland, so I am teaching first grade students virtually the entire time. I'm putting in the 10 to 12 hour days that it takes, plus some sometimes, to reach every family and to reach every child. And yeah, it's a struggle. I'm just gonna ask everybody right now, the last time you tried to learn something new, how long did it take you? Because our kids, they're learning something new right now. Not only that, the whole district just started a whole new program with Canvas. So they're learning a new program too. So those failures aren't necessarily because we're failing at distance learning and a hybrid model. It's because we haven't given them time yet. We haven't communicated to them enough yet. Well, Kelsey came up here and said about having the counselors being reaching out to kids. I have my youngest, who, trust me, she's a handful, right? Gifted and 504. I mean, it's a whammy. I gotta keep up with her like no tomorrow, and I thank God for every teacher who's ever called her. Because if it weren't for their communication and constantly reaching out to me, I would never know what she had going on with her at the time. But they do it. And then I follow up and I support as best as I can. And I get her rolling again. And if it weren't for them reaching out, if it weren't for the counselors who are now doing weekly check-ins with her, she would be feeling too right now. She was in the spring. She failed a class and I had no idea. And I'm a teacher, okay? I felt like a failure as a parent and as a mom. It's hard. And what we haven't done is we haven't given ourselves grace. We haven't given ourselves time. But it's possible. What's not possible is going back into these buildings and suddenly having kids quarantined on crazy, ridiculous schedules and inconsistent. The worst thing for our children is inconsistency. And by putting them in buildings where they are going full time and being around each other, and then all of a sudden getting phone calls where they say, oh, sorry, we're closed for a week right now because we gotta clean everything, we gotta quarantine, we gotta do this. That is horrible for kids. It is a terrible decision, especially right now with cold and flu. Because when these kids come in, what are your indicators for their symptoms? The same one as the flu. What are you gonna do? You're just gonna send them all home? Now nobody's learning. I think we need to find more supports, get your counselors involved, get your resource people involved. Take a look at the kids who are failing. What is the problem? What is the communication that's gone out? The other thing is coaches. With athletics, they were a huge part of making sure our kids weren't failing. They looked at the list every week. Is that still happening? Half the sports aren't even in. So, what is the system that's in place that's looking at the kids that are failing? What are we doing there before we jump in all of a sudden to, all right, let's get them all back in, and then make our teachers who are already, I'm telling you right now, at their max. So you're not asking them to go not only to their max, but put their safety at risk too. It's just, it's not right.
Good evening. My name is Amanda Weaver. I have children across the district. I have 3 at Manheim,
and I have one at the middle school for his first year. I wanted to take a moment to thank you for making a decision. Either way it would have gone tonight, it would have been impossible. And I apologize to you for being forced to do it, because we're all being forced to make decisions we don't want to make. I'm up here tonight because I'd like to tell you that while many didn't get the answer they wanted tonight, you have an army of mobilized parents ready to help. I know that the teachers are scared. As a mother, I am scared. But I've been scared since the day they were born. The first time my oldest son coughed, I swore he had RSV and I took him to the emergency room. They told me I was crazy and a first-time mom. Fast forward 11 years, hasn't changed much. So I will do anything and everything you ask to make sure that my children and my children's teachers, administrators, support staff are safe. And I know that there are parents just like myself sitting and watching tonight who are ready as well. We can't be in the buildings, and we understand. Volunteering can't happen, and that's okay. But putting us into a building isn't the only way we can help. So please, please reach out to your parents. Use your PTOs, your PTAs, use your soccer moms, use your football dads, use the coaches' wives for all I care. But use every resource you can to make sure that every single hand in this district has a hand in keeping everybody safe. It is not the teacher's job to keep everybody safe. It is not my job to keep everybody safe. And it certainly isn't your job. Reasonable care is what is being asked. Let us help you do it. We're up.
Hi, I'm Jamie Garrett. I have a son who is in 4th grade at Park Hills, and I have a son here at the high school in 9th grade, first time here at the high school. If my son Drake would have known that he could be here to talk, he probably would have prepared something to do so. He is a talker, as some of you may know, and he would have shared his concerns he's had over the past few weeks, along with my concerns. I want to thank you very much for the decision you made tonight. And as others have said, we know that it's a hard decision. We're caring. We're very, very fortunate for the caring faculty, staff, bus drivers, teachers, parents, everybody around us, and we're very thankful for that every day. I will say that I have witnessed, being working from home since March, struggles that both my kids have had. My son in 9th grade is very different learning style compared to my 4th grader. My 4th grader has an IEP. He is in full 5 days. And thankfully for that IEP, that he can be in full 5 days. The week that they were at home was a huge struggle, huge struggle. I was working on my laptop, running back and forth between my work, jeopardizing my job, and trying to help teach my 4th grader, who was learning at a very, very difficult pace and very much challenged. I thank you and applaud you for the hard decision you've made, but I believe that we, as everybody else said, that we need to support each other. We need to not live in fear. My oldest son is typically a very good learning student. He is struggling currently with a class. This week he's in school one day. One day. It's very hard for me to see him in the past few weeks struggling with this one class and basically having a meltdown because of it. Because he can't get the support he needs that he normally would in school. So again, as others have said, it is a hard decision. I understand it. We don't know what the right decision is. We understand that as parents. But I just want to say thank you very much for everybody doing what they can to support the kids
and there's teachers doing what they can to support the kids. We want to be there as parents to support everybody and help too, as much as we can. So thank you.
Our motion to adjourn. We have a motion, do we have a second? All those